why do you think women don't reach out for help with this more often?
I think because they don't know it's an option. They can't exactly identify what they don't like about it. And then they think about it, but maybe you're not going to do any research. Or you don't know anybody that said they had it done, even though you might know people that's had a labiaplasty, but they just don't talk about it. It's hard for us to it's not hard for us to talk about it. We can talk about labiaplasty all day long, but
It is very intimidating. If I didn't know and I didn't work here, it would probably be an intimidating thing to talk about.
Yeah, I think it's similar to if you're around that, it's, not a big deal to us to discuss it. Sort of like if you're a child of an OBGYN and you go to school saying vagina right away,
Right.
and you're like, well, that's what they talk about at the dinner table. So I think, yeah, it's not spoken about. And for plastic surgeons, we do a lot of our kind of advertising and promotion and education is all very photos based, right? Everybody loves to go on Instagram and see the tummy tuck reveal or, go on TikTok and see before and afters or what liposuction looks like behind the scenes. But you can't really do that for labiaplasty. And so there's less talk about it in that format as well. There's less visual.
Right.
I know I have this one video of where I'm operating on a artificial flower because that was the easiest way to kind of demonstrate what's happening during a labiaplasty. And it's a very popular video and it's a safe way of talking about it and advertising it. Not advertising, but letting people know that, hey, this is out here. So it's a little bit harder to get access to the information. And then, as with anything, there's always these horror stories and people who are just if you're pregnant, the last thing you want to talk to are the people in the waiting room, because everybody who's ever been pregnant is going to tell you their worst horror story about being pregnant. And you get kind of a biased view of what things are going to be like.
Right.
So we have had I would say that's for any procedure. I've had patients who start Googling stuff and looking at things on YouTube the night before their surgery. And I always tell them that's a terrible
Google
idea.
is not your friend, let me tell you.
No. So yeah, I think if you're not approachable, they're not going to ask about it, right? And if you don't know that there's a solution, you won't ask about it. It's very similar to cellulite, right? And I certainly don't ask patients about it if they're not coming in for asking that, I wouldn't, again, because it's a very personal choice. So when I see patients for other procedures, I'm not like, oh, okay. And while you're under, have you considered a labiaplasty? That would be completely...
I was just taking a look at it and thought that I could help you out here.
So not appropriate. Because like I said, it's all variations of normal. So it really boils down to personal preference.
What do you do to not make this procedure awkward? Besides have me in the room.
I think if you don't make it awkward, it's not awkward. I was going to say everybody has labia, but not everybody. So half the population has labia. Maybe more than half, honestly, on any given day, right?
You're right.
So yeah, I think it's normal human anatomy. It doesn't have to be uncomfortable. I would say I think I've seen one teenager who maybe in the consultation that as they were setting up was uncomfortable having me do the exam. And I said, Megan appropriately talked to the mom and said, that's fine. We don't have to do an exam. We're not doing surgery, right?
Right.
If the patient isn't comfortable having me examine that area, then they're not going to be comfortable with the whole concept of modifying that area. But what we did do was I said, just bring her in and we can just talk about it. If she wants to see pictures, we can look at pictures. And then that's just food for thought. She's educated. And then when she's older, if that's something she chooses to do, or she gets to a point where she's comfortable having an exam down the road, then you can do that. I'm not going to tell, somebody no. I'm going to offer the opportunity to educate them. But that's also absolutely not a good candidate for surgery. So if you're feeling awkward about letting me see the labia or what your concerns are, then maybe you're not at that right mental state to go ahead and proceed with the procedure, right? But for most of us, it's just not awkward. We don't care if you're on your period.
You're in office if All
All
girls.
vaginas. Yeah, it's no big deal.